Hey there, Dr. Norris Goldberg, owner and clinical director here at Koru Chiropractic, and I'm also certified as a NUCA practitioner, which means I'm an upper cervical specialist when it comes to chiropractic care. Now today I want to talk to you a little bit about cervical spine instability or craniocervical instability. There's two different types of instability you can get in your neck and your spine. You can also get it in other areas of your spine, but the most common is up here in the neck because of the fact that we have a big heavy bowling ball on a little broomstick neck and it's prone to injury. It's the most mobile area of our spine and therefore it is the most likely to get injured. So we need to be able to move, we need to be able to turn and bend, but unfortunately it's injured in things like little whiplash injuries or slip and falls or even head injuries often displace the neck and cause a shift in the upper cervical spine. And so what that looks like, everybody's misalignment is a little bit different, but usually there's a lateral displacement of your C1 or your atlas bone and some rotation of C2 and really all the segments below that when you get an upper cervical misalignment. So that's the most common place to get upper cervical instability, and a very serious whiplash injury or injury to the head can cause these problems to occur. So what happens is, we don't see this in the model, but there are several different ligaments and different layers of tendons and ligaments in the upper neck holding your head onto your neck so that it doesn't just fall off or get knocked off. But what happens is this, on the inside, these ligaments that connect the C1 to C2 and the two of them to your base of your skull are very small. They're about the size of a strand of floss. They're very, very skinny, very short, and under certain conditions they can be torn. Now this is very unfortunate if it happens, but there are natural things you can do to increase the stability of your spine and get yourself out of pain. Most people who have instability have more than just neck pain. They have, chronic headaches and migraines. They might be getting dizziness with certain movements. There's a really usually high pressure or maybe even a grinding feeling at the top of their spine because the joints are becoming so disarticulated. And this is a serious issue, and most people know they have it because they're in so much pain. It's way beyond just the daily neck pain and headaches that the average chiropractic patient has, okay? Now, we can evaluate that in a few different ways. For myself as a NUCA practitioner, we look at the alignment of the head to the lower neck, and if it's orthogonal or plumb and level like a cross, then you're in good alignment. But most people, like I said, they have some sort of distortion of their neck and either a lot of pulling to the side, or it might look like it's straight up and down but the head is kinked to the side, and we use a specialized x-ray to analyze it. Then we do a gentle hand adjustment, and then we re-x-ray it to make sure we are getting the maximum improvement in terms of the alignment. That way it doesn't need to get as adjusted as often. The adjustments are very safe because we're working with something that's unstable. We don't want to be putting a ton of force into it. So we put just enough force to glide that bone back into place without twisting, cracking, or popping the neck. The second area that we oftentimes will see instability is lower in the neck, in between two of the lower vertebral segments that have discs. So that's everything from C2 below down to your tailbone. And these other areas right here, usually you have a lot of ligament connecting the spinous processes here, the transverse processes, the facet joints, and the disc. Now the disc can be torn, you can get a herniation to that, but if that happens, there's typically some ligament tearing as well. And what will happen is the vertebra will slide forward, or the one below it will slide backwards, okay? So this is an extreme example. It's not ever gonna be like that. That's called the dislocation. That's not what we fix. That's an emergency situation that you would need to go to the hospital for. However, a slight shift of the vertebra, usually a grade 1 or 2 spondylolisthesis, whether it's anterior or retrolithiasis, we can help. So we use, again, a very specialized type of x-ray where you're gonna do what we call a motion study or a stress x-ray looking up and down, and we can see where the bone is either moving or potentially not moving. We can also determine if it's safe to adjust, and then areas that potentially need adjustments. A lot of times, one area is overmobile, it's hypermobile, and the area below that is fixated or stuck. And so if we can loosen that up and strengthen the area above, we typically get great results with people who have cervical spine instability. So again, sometimes it's an upper neck issue, sometimes it's a lower neck issue down around C4, 5, 6, or 7. And those are the types of issues that I really like to help people with because quite honestly, most people, they find me last. They've gone and tried a lot of things. They've done PT, injections. Many people, by the time they find me, are considering alternative medical approaches, not just things like chiropractic care, but potentially even things like stem cell injections. And while I think that can potentially help, even the stem cell injection places, the world famous Regenix right across the street, the Centeno Schultz Clinic, they actually send me patients who are signed up to get the injections. They come in, they get their orthogonal NUCA correction before the injection, and they get checked after the injection to make sure that they stayed in place during the procedure, because of course they sedate you and you're passed out and they're having to move your head and neck around. So we want to make sure you're maintaining that alignment. So if you're in the area, if you're in Louisville, Colorado, Boulder, or even the Denver area, or even all of Colorado, or out of state, I do have out of state patients travel here for these procedures. However, local is always best, and if you have a cervical instability issue, if it's causing a plethora of symptoms that you can't get under control, I would love to consult with you and show you what NUCA chiropractic is and how it's different from traditional chiropractic care and how it could potentially help you. So hope you guys enjoyed today's video, and if you did, give us a thumbs up, like, and subscribe, because I'm going to produce many more.